That was cool.
It's really dramatic. The video will go away eventually. There it is. And here we are. Joe Moore, Psychedelics Today, joined by Brom Rector. How are you today, Brom?
I'm doing good, Joe. Thanks for having me. It's been a very long time since we recorded in my place in the Arts District. I feel like that was like 2 years
Right.
ago during COVID,
Felt like
near
forever
the
ago, yeah.
Wisdom venue, which
Ooh, the notorious wisdom.
I don't know
Yeah.
if you know this. The Wisdom is closed and it doesn't even exist anymore.
Wow.
It is now a
Interesting.
parking lot.
So, yeah, we got caught up in their bankruptcy situation. I heard they were going to relocate somewhere. Um, but
Maybe.
yeah, that was fun because yeah, I was like checking out the venue. We were hanging out for a minute, recording, and yeah, that was a fun apartment you had there. I like
It
that.
was. Yeah, I liked it too. It was fun, but it was time to leave LA, and now here in San Francisco. Um, but yeah, man, it's a very different world compared to when you and I first met. Uh, it, Both in terms of the world itself and also in terms of the psychedelic world. So I'm excited to see what you want to talk about today.
Right, a lot has changed. So when we first connected, you were running a fund called Empath Ventures. Is that right?
That's right.
And now kind of going as focal point.
Yeah, we so in 2021 started Empath, and my vision at the time was to invest specifically in companies that were related to psychedelics in some ways, whether that was
Mm-hmm.
developing psychedelic drugs as pharmaceuticals, whether that was like an ibogaine clinic in Mexico, whether that's like telehealth ketamine, any sort of business that was related to psychedelics. I wanted to fund it, and I did do that. And then in 2022, probably like the second half of 2022, the number of new companies being started in psychedelics basically went to zero. And quite difficult to run a fund whose purpose is to invest in early stage startups when there are no early stage startups being formed. And so, because of that sort of market dynamic shift, started looking at other things that were in service of the same mission as psychedelics, treating disorders of the brain, whether that's like neuropsychiatric disorders, neurodegeneration, but just using different technologies. Because I guess, like, does it really matter if you cure the problem with psychedelics versus a brain computer interface or a gene editing tool? Like, probably not. I still have a special place in my heart for psychedelics because they've done a lot for me and people that I know. But yeah, we started investing in those adjacent areas. And so now, like, with the rest of the money in the fund, have invested in companies across all those categories: psychedelics, brain computer interfaces, a little bit of sort of like consumer longevity stuff, a little bit of genetic medicine. And the rebrand from Empath to Focal Point was just because, Empath was actually a pretty cool name, I feel like, but it has a very specific connotation. And I felt like it was a great name if you were a psychedelics fund, but when you started talking about other things, I don't know. It seemed to kind of confuse people, so we rebranded a little bit. And rebrands can be good or bad. I think that this kind of happened alongside the time when a lot of companies in the psychedelic space were like stripping the word psychedelic out of their branding. Um, so this is not necessarily a new phenomenon, right? Like Johnson and Johnson, when they lost Spravato, they never said psychedelic. They were just like, "This is a special drug," and they barely even said the word ketamine. And then Gilgamesh, which like started off as a very psychedelic drug company, they ended up doing this $1 billion deal with AbbVie, and the press release didn't have the word psychedelic in it anywhere. Um, and yeah, there are tons of companies that are
Did they
kind of
say
rebranding.
psychoplastogen?
I think they said like neuroplastogen or something like that.
Mm-hmm.
Um, One of the companies we invested in, Silo, obviously the PSY there, that's kind of like psychedelic. They rebranded to Xylo, so they have an X now instead of a PSY, or so a little bit different. But yeah, it's like everyone is trying to kind of distance themselves from psychedelics because they feel like the market isn't favoring it. I sort of feel like maybe that's a sign that you should stick with psychedelics because at some point the pendulum's going to swing the other way and you want to be the one person that's like been consistent the whole time. But maybe that won't be the case. I'm not sure.
That's interesting. Um, and the idea that in late 22, like things seem to have halted with like,
Yeah.
and to be clear, like you're kind of focused on biotechy things and a little bit of the retreat angle back then,
Yeah.
and Yeah, like the financing. Yeah, it seemed like it dried up, or maybe the space was too crowded. Do you have any speculations on what was
Yeah.
going on there?
Well, it certainly wasn't limited to the psychedelics world. I'm not trying to say that like the psychedelics
Mm-hmm.
market got screwed. It was just that, first of all, from like the end of 2020 through 2021 was like one of the craziest investment bubbles that we've seen in the last few decades. You know, interest rates were at zero. Everyone was stuck at home, and there was like all this free money floating around. And so everything was getting funding, whether it was psychedelics or whether it was that bio company whose mission is to resurrect the woolly mammoth and basically create Jurassic Park. Like that's a real company that got funding back then and is still raising lots of money. There are all sorts of like really out there things that were able to raise money during 2020 and 2021. And then, you know, as there always is, a bit of a correction. Interest rates got raised, which means that it's more expensive to get money, and investors just started becoming more conservative. And so when that happens, the higher risk stuff is usually what crashes first or slows down first. And obviously
Mm-hmm.
psychedelics is going to be in that like high risk experimental category. So that's why not only, I mean, really, like the number of startups getting funded just generally slowed down tremendously. Psychedelics slowed down probably more than any other category. But yeah, we had to kind of figure out an alternative option, which is what we did. And now things are maybe
Oh
starting to
yeah.
swing the other way, but I'm not sure.
Mm-hmm. It's gonna. Right. I think like Thursday is gonna be a really interesting pivot point to see like what might happen with I guess we call it the
RFK.
perspective or expected RFK confirmation.
Yeah.
But we'll see. I don't actually know how much of an impact that's going to have. Do you have any speculations there?
Yes. Okay. So there are a few things. First of all, I just thinking back to like Trump's first administration, everyone that he brought in got like fired within a year. So even if like RFK is wants to do all the things he says, I feel like as soon as Trump realizes that like RFK wants to take away his McDonald's, he's going to fire him. You know, Trump to me, like regardless of whether you like him or don't like him, I don't think anyone would make the argument that he's like a health conscious person. You know, forget mental health, just like health in general. Like, he's not a guy that really seems to care that much about like whether he is healthy or the people around him are healthy. He famously like loves fast food. And if you ask Trump, like, what are the top 100 things that you think are important to do during your term? I don't think like psychedelics would even show up on that list. That's my guess. I don't even know that Trump really knows what psychedelics are. I don't know if you saw there was that interview that he did with Theo Vaughn like a week before the election,
Yeah, I did see a couple clips from that.
where Theo Vaughn is like describing what cocaine is to Trump, and Trump is like, "Wow, that's really interesting," as if he's like never heard of cocaine before.
That's so
I
crazy.
just don't think that like the idea of mental health and psychedelics specifically is like anywhere on Trump's radar. So then the question is like, all right, well, let's say that maybe RFK is actually able to operate with some autonomy and Trump basically gives him a blank check to do whatever he wants. Um, Even then, I think there are going to be some challenges. Like, one of the things that's been so weird, dude, is just the way that psychedelics have gone from like being a left wing coded thing to sort of like a right wing coded thing. And now
Mm-hmm.
there's like a fracture. So it's like, obviously, with the Make America Healthy Again, the RFK, the like libertarian wing of like the MAGA movement, they're like all for psychedelics because like psychedelics are great and they help veterans and they help treat like the fentanyl crisis. So that's all good. But then you look at like the more tech bro, like Silicon Valley wing of the Republican Party. I don't know if do you know who Mark Andreessen is? The big like venture capitalist.
He's been getting some negative press the last couple of days, but yeah.
So
Mm-hmm.
so yeah, he's the founder or one of the co-founders of Andreessen Horowitz. They're, you know, one of the biggest, most influential venture capital funds in the U.S. And just a few weeks ago, he went on this like Twitter tirade where he was like saying how psychedelics are like lame and bad. And like no one should do psychedelics, and like psychedelics distract you from making money, which is the most important thing. Like I'm kind of paraphrasing here, but like you can look up Mark Andreessen's Twitter. You can, you know, probably search psychedelics and you can find all the tweets. And he's like, we invested in all these founders and then they went and did ayahuasca and then they like stopped caring about running the company successfully. And like basically the two, so it's like though the people in that like tech sphere, they view the Trump presidency not as like make America healthy, but make America like accelerate and succeed in business. And for that, you want Zyn pouches and caffeine. You don't want psychedelics. So like, it's kind of weird. There's been this weird fracturing. Um, and then at the same time, like the radical left wing politically, I don't really know what their view is. Sometimes it feels like they're pro psychedelics. Sometimes it feels like they're anti psychedelics. But if you look at like the median like coastal liberal, my sense is, and this is from someone who spent the last few years living in LA and now lives in San Francisco, during 2020 and 2021 and 2022, there was like a bunch of excitement around psychedelic medicine. And in fact, there was a bunch of like, let's be more permissive with all drugs. But now I think there's this kind of thing where people in LA and in San Francisco are like, wow, look at how bad the homelessness crisis has gotten. Look at how bad the fentanyl crisis has gotten. We need to take action and not let people do whatever they want. And that's why San Francisco just elected a new conservative in quotes, right? Like conservative by San Francisco standard, whose like platform is we're going to clean up the streets. And it's easy for someone listening to this podcast to say like, oh, well, you're talking about fentanyl addicts versus people using mushrooms. But I just don't know that the average person cares about that nuance. Like, it's like, you're either pro drugs or you're anti drugs. That's, the amount of cognitive processing power we have available. And I wonder if like with that shift towards like, we tried this thing where we let people do whatever they want in terms of drugs. And it ended up with like all these crazy like crackheads and fentanyl addicts running around doing a bunch of crazy shit. We need to like tighten things down. So yeah, I don't know. We're in a very strange place. That was a long rant. But
No, it was helpful. Like, yeah. So there's this thing on the left, to your point about like what is left thinking. There's like this dichotomy that goes back to like the 60s, right? It was like the hippies versus the yippies.
yeah,
The yippies seem to be like a little bit against mind expansion. They were more like, let's be very forward politically. And then because their critique was, people were getting a little too hedonistic and
yeah,
losing sight of the ball politically. And, maybe they were right. Maybe that's why we're here today, but who knows? But yeah, I could see a sort of critique there from some political sectors. And
yeah.
who knows?
All that said, though, I will say that I think that none of that really matters that much in terms of FDA approval of psychedelic drugs. Maybe it matters on the level of like, is California going to pass like a decriminalization bill or something? But I still do think that there are going to be some big businesses made in psychedelics, maybe at like the FDA approved level. And because everyone is so negative on like the psychedelic capital markets, for lack of a better word, now is probably the time to like pay attention to that, because you want to be paying attention to things when everyone is saying that it's over and it's done and it was a stupid idea and we never should have done it in the first place. I think that's when you want to kind of buy the dip, for lack of a better word. Not suggesting anyone buy like any of these publicly traded companies, but there are still companies that are doing very interesting things. You look at like some of the big privately held ones like Gilgamesh, Delix, some of the companies in our portfolio, Silo and Mindstate Design Labs. Those companies are still making progress. They're kind of ignoring all the political noise and the fact that there's been an election, and they're just making progress. So I think that is good. It's good to know that people are still doing work regardless of, what's happening in the headlines.
Agreed. It has to.
Yeah.
Yeah. People have to keep pushing on.
And I still think MAPS is going to succeed at some point.
Yeah, I think there's no way around that. It seems just like an inevitability. Do you know what happened with that deal with the Musk dude? What was his name? Gracias.
I don't. We invested in Lycos. We were a very, very small investor back in like 2021, and so we don't have any like superior information rights or anything into that. So I know the same thing that anyone else who's read the headlines knows, unfortunately. And I'm not sure if they like accepted the deal or not. The last I checked up on this was like a week ago or something like that. But yeah, it's super unfortunate that the drug didn't get approved, but whatever, lessons learned. And I guess they can, as long as they can secure funding, they can do it again.
Exactly.
And I'm
I
still
have some
bullish on
inside beta.
Compass.
I'll share
Okay.
later offline.
All right. The top
Can't-
secret.
I can't. But like so from what I recall, it was like the board plus um, Helena Capital
Yeah.
had to either approve or reject the offer from Gracias. And
Yeah.
I think I've not heard news at all in like 2 weeks, maybe, which is interesting. Um, some of my friends at Maps like didn't get back to me till yesterday on
Oh,
just like
okay.
not even like investment related stuff. You know, it was fascinating. So they must be heads down, working
Yeah.
on comms and everything else.
Probably. Yeah. I don't really know what the deal is. I mean, I assumed that, you know, I don't know. I assume the deal is not like great for the shareholders, but I guess the ultimate goal is to get the drug approved and get it to patients, not necessarily for people to make money. So, at least in this case, right? It's a PBC. So, as long as that
Mm-hmm.
happens, I'm fine with it.
Right. I would love to just see it. Yeah, make its way through. And um, what has happened is interesting. We've seen since the FDA rejection a cooling in the psychedelic business, which is like it's interesting to see because like the psychedelic business historically is like quite outlaw, but like having like
Yeah.
FDA approval kind of impact so seriously a lot of businesses is really interesting to me. But I think it's kind of just a sign of where people's heads are at. Like they want legal access more so. And you probably know the prices, but like I was working on a deal recently and $1,200 a dose for GMP MDMA recently. Like
Jeez.
for yeah, and I don't even know if that was with boosters. You know.
It's quite expensive, but I guess people feel that maybe insurance would cover it if it was really warranted or something.
Yeah.
Yeah, it's expensive stuff. But it's like on the one hand you can say there's a cooling, but on the other hand, Johnson and Johnson is making almost $1 billion a year with Spravato, and they're only serving it to like less than 100,000 people. I think it's like still pretty small in terms of number of people.
Mm-hmm.
So there is money being made. Mind Bloom is mailing injectable ketamine to people's houses, which I think is great. And so I guess cooling on the one hand, but on the more like corporate side of things, it feels like people are still quite interested. People have
Mm-hmm.
short-term memories. Like when Matthew Perry OD'd, every time I brought up psychedelics or ketamine for like 5 weeks, 5 months afterwards, that was all people would say. And now like I haven't heard anyone mention it. So
Yeah, it
you
just
just
came
gotta
up for
let
me
the
2 weeks
bad
ago.
news just like go into the rearview mirror.
Totally. And the lesson there, don't do ketamine in the hot tub alone. Like it's
While doing many other drugs at the same time.
right.
Yes.
Yeah.
Yeah. Bad
Also
idea.
that. I think both.
Yeah.
But yeah, like it's a surefire way to have a hard time. And historically, John Lilly, he almost drowned himself injecting ketamine in float tanks, and I think he eventually stopped because his wife pulled him out and saved his life at the last moment.
Yeah, drugs
Yeah.
and water, not great combination generally.
Mm-hmm.
You want to make sure you can breathe.
Yeah, yeah, it's important. So, in terms of like, you've made an interesting pivot, right? Like, so you've not purely psychedelic anymore. Like, psychedelic
Correct.
is cool, but it's not like necessarily the only way to solve these things, right? Like,
Sure.
you were saying earlier, computers, like implantable computer things, like probably
Yes,
things
brain-computer
more.
interface.
Yeah, brain computer interfaces. So like that's a really cool sector. I think it's the case that Elon gets all the attention with Neuralink, but there's probably a bunch of other startups doing really interesting stuff too. Is
Yes.
that the case?
Yeah. So first of all, I mean, yes, you're right. Elon gets all the attention because he's Elon. There were companies working in that space before Elon, and there were a bunch of companies started up afterwards. And there are varying use cases for this. So first of all, it's like there's two things you can do. You can read from the brain, which is good if you're
Mm.
like paralyzed and you want to be able to read what the brain is thinking, so that way you can control like a electric wheelchair or a computer mouse, which is what Elon is doing with Neuralink. That's a great use case. But you can also write to the brain, and that sort of sounds like implanting memories or something crazy. We're like very, very, very far away from that. But what we can do is do very basic like electrical or magnetic or ultrasound type stimulation of certain brain regions that are correlated with like depression, anxiety, focus, etc. You've probably heard of TMS, right? Yeah. So TMS is like transcranial magnetic stimulation. Generally, one might go to like a psychotherapy clinic that has a TMS machine and you kind of sit under it. But it's
Worth
kind
noting
of
there is insurance reimbursement there
there
for
is
that.
insurance reimbursement for that. That's
Yeah.
true. The problem is it is a pain to go to a clinic all the time to do a full course of TMS. I think the TMS treatment is like 6 days a week for 6 weeks. So you have to go to a place 36 times. Not ideal if you're like severely depressed.
I
So
did
if
a
you
protocol
could,
with TES and it was 30 times.
wow.
And that was hard.
Yeah.
I made a great friend at the clinic.
Yeah, I bet.
30 times.
So there's like this question of if you could just miniaturize the technology and put it in like a tiny little like minimally invasive implant and then just have that stimulation, that could potentially help a lot of people. So there's a company called Motif Neurotech that's doing that, and they're specifically targeting depression. So this isn't like, some like neurodegeneration or paralysis that they're trying to fix. They're trying to treat literally exactly the same thing that these psychedelic companies are trying to treat. And when I tell people about this, people always think it sounds like totally insane. Like, who would possibly get a little hole drilled in their head? And it's like, well, first of all, have you ever been severely depressed? There are certainly people that are like at the end of their rope that have tried everything and will try anything that you offer them. Two, this is like, whenever I say this, people think I'm just making like a crude joke or whatever, but it's like, have you seen how many people have like breast implants? People get crazy surgeries that are more invasive than this just to look good. And if you look at like the rate of purely cosmetic like plastic surgeries, it's trending up over time. And in certain countries, it's extremely high. In the US, I think it's somewhere between 3 and 5% of people have like a cosmetic surgery done. In South Korea, which is the plastic surgery capital of the world, something like 20% of the population has had cosmetic surgery. And it's like, cosmetic surgery is, I guess you could argue there's like some benefit there, but it doesn't help you with anything. Whereas these are very minimally invasive surgical procedures that have, that are outpatient, that you can be home the same day, and they could seriously like help you with your mental health, maybe even your mental performance, depending on, how these things are wired. So we've invested in 4 companies in that sort of brain interface category, pretty much all focused on stimulating the brain in various ways to treat, whether it's depression, like Motif Neurotech, stroke and neurodegeneration, like Neurobionics. And there are 2 other companies that are a little bit more stealthy that I don't want to talk about. But that's a big area that we're investing in. And then the other one that we started getting into a year ago was genetic medicine and like RNA therapeutics. I know that RNA therapeutics, lots of controversy, because of the COVID vaccine, and there's always, just this idea of like gene editing scares a lot of people. But to like draw a psychedelic analogy, most people listening to this podcast probably know that psychedelics work because they agonize your serotonin receptors, specifically like 5-HT2A, right? So if you want to treat some kind of depression or you want to induce some sort of like psychoactive experience, you get a drug like a psychedelic and it like floats around in your body until it interacts with a serotonin receptor, maybe a 5-HT2A, maybe another type of serotonin receptor. With the right mRNA therapeutic, you could potentially make your body create more 5-HT2A receptors. Or maybe you could give it instructions to create a new special designer serotonin receptor that is more sensitive so that you get like higher levels of serotonin uptake. So these are things that are like
getting me excited.
Yeah, these are things that are very possible with technology as it exists. It's just a matter of like proving it out in the clinic. But like the RNA stuff is really fascinating because the RNA sequence is literally just a little instruction that tells your body to make a specific protein. And all of these little receptors, 5-HT2A and dopamine, serotonin receptors, these are all just proteins that your body produces. So if you can give it the instruction, you can tell it to make more of those proteins, or you could maybe give it an instruction to create a special magical super serotonin receptor that doesn't even exist naturally in the body. So lots of interesting directions for this like neuro brain modulation health to go.
So Do you have like a really quick description of what mRNAs or like vaccines are doing? Like
Yeah,
how do
well,
we explain this to a lay audience?
sure. Well, I actually just recorded a podcast with one of the founders of our kind of first mRNA company that we invested in. So people should look me up on LinkedIn and find the link to that where we explained it. But basically, so the mRNA is a little sequence that your ribosomes in your cells read, and based on those instructions, they go ahead and they create whatever protein you tell them to create. And everything of interest in your body, more or less, is like some kind of protein. So the 5-HT2A receptor is a protein. Your dopamine receptor is a protein. Some of the antibodies, like that they were trying to induce with the COVID vaccine, those are proteins. And so by creating a specific set of instructions through mRNA, if you can deliver that set of instructions inside the cell, then your body will just make more of whatever type of protein the instructions tell them to make, basically, if that makes sense.
Yeah.
So the analogy that we talked about on the podcast with him is like your DNA, that's sort of like the master plan. That's like the source code of the entire thing. Maybe it's another way to think about it would be it's like the master plan for the entire building. And the mRNA could be like the specific set of instructions on how to make like this one little part, which is that specific protein. That's a very non-expert like analogy that probably has lots of holes in it, but I think it's more or less directionally correct.
Yeah. Yeah, it seems that way to me. And to your point earlier, like the idea of being able to develop more specific receptor sites and or more of those free-floating molecules, like fascinating. Like, what if you could do mRNA instead of an SSRI, for instance?
Sure.
2
Yeah.
injections a year, 1 year.
Just have it make more serotonin receptors or more of a specific type. And maybe that would help. You don't even have to mess with your body's natural serotonin levels. You just get more sensitive to it. So yeah, it's quite interesting. Luckily, my partner, Samantha, who I run the fund with, she is a bio expert, whereas I'm not. So she understands these things on a level much deeper than I possibly could. And so we have the capability to evaluate the claims that these companies are making. But they're actually, the company that I was just referring to that we recorded the podcast with, they're not necessarily focused on creating more serotonin receptors. They have other ambitions. But there are companies out there that we've seen that are actually creating like genetic medicine. Some of them are mRNA based. Some of them are like other gene editing type modalities for mental health specifically. So like this is not some like theoretical thing. There are actually people trying to do this right now. There's another, this is like just totally going off like into the wild here. But there was a company I looked at like a few weeks ago. I should see if I can find the name of it. Basically, they found this woman who lives in like Ireland or someplace or in that area of the world. And she basically feels like she's on MDMA all the time. Like she's just like, from the time she was born, she's just been like the happiest person. And she's like, doctors were always like wondering what was wrong with her. Why is this woman like acting like she's like rolling nonstop? And they basically found that she has this genetic mutation that causes her to just be like insanely happy. And it's like impossible to make her sad. And so this company basically is like trying to figure out if there's a way that you could create like some sort of CRISPR gene editing tool to just like give anyone that mutation, just like turn off the sadness gene. I don't know if it's a great, yeah. So that like, I think it's called the Far Out Project or the Far Out Initiative. Let me just Google and confirm, but
this is, kind of
the Far Out Initiative. Yeah. The Far Out Initiative.
Like biotech's kind of been talking about this and, with the democratization of things like CRISPR, like this has been kind of something we've been chatting about for a few years. Now it's just people are actually committing resources to it. And that's really interesting. Yeah.
And, in the US, it's like it takes forever to get anything done because we have this thing called the FDA, which I actually think is good. And it's good that it's not easy to just like make a gene editor and start selling it on Amazon. But there are some people that are particularly like risk tolerant that are setting up shop offshore and are like actually delivering experimental gene therapies now. I don't know if you've ever, maybe we even talked about this on our last podcast, but have you heard of Prospera before?
No.
Dude. All right. So this is a fun one. I'm actually, well, okay. First of all, Prospera is like a autonomous zone in this little island off the coast of Honduras that a bunch of like crypto people.
Oh,
Yeah.
they
Have you
tried
heard
to
of this one?
recruit me, and then
Did
they
they?
told me like, and then they're like, "Oh no, that's psychedelics. You're out."
No
I was like,
way.
"Oh,
Really? They're
great." Yeah.
anti-psychedelic. Well, I've never been there. I have no affiliation with them. I just know that basically it's a bunch of people that have, money. I think they're maybe like crypto sort of affiliated, and they created an agreement with the government of Honduras to allow them to basically do whatever they want on this island. And so they're basically operating these like gene editing clinics now, and wealthy folks from the US are flying down there. So rather than spending a bunch of money to like do a clinical trial in the US, they're having people pay them to be like guinea pigs. And if you watch, have you seen the Brian Johnson documentary on Netflix?
Not yet. No.
All right. Well, so in the documentary, he actually goes down there and he takes this experimental gene edit thing that basically that it's a myostatin inhibitor. And if you've ever seen the picture of the super jacked cow, the like giant cow,
Oh, yeah.
yeah. So that's a cow that's born with like a myostatin gene. Forget the term, but I forget if it's inhibition or the opposite. But basically, this gene controls like the level of muscle you grow versus like how much fat you have. And so if you modulate this gene, in theory, you should be able to like grow way more muscle and like not have any fat. And so there's this company down there that claims that they've developed this like injectable gene edit that you can just like inject, and then your genes get modulated. Of course, it's very tough. It's tough to do that because you have to, if you're going to edit your people's genes, you have to deliver the gene edit to like every single cell in your body, because every cell has a copy of your genes. And so they inject it like into the stomach, and they hope that it kind of spreads around like the abdominal fat, but it's impossible for them to like deliver it to every cell in your body. And that's the delivery is one of the main challenges with gene editing. So anyway, the point is,
Does it
there's
look like an mRNA feature? Do you know what
it
the
is
delivery
that
kinda looks like?
that particular drug it's not mRNA. It is I think it's what they call an oligonucleotide, which is I could be wrong though. I don't think it's mRNA. I think it's like a different. There are multiple different like gene types of genetic medicine.
Yeah, I remember
they're
ages
with
ago there was
chicken,
kind of
yeah.
like the virus, like kind of like they would use a virus to deliver.
Yeah, the viral vectors. Yeah.
Yeah, but I'm sure there's so many more now. I've not tracked it in ages, but you've been doing some good work. I love that
Thanks,
you've been
man.
doing this reading.
I mean, yeah, it's an interesting world out there, and I think that with like, there's a lot of hype around AI and a lot of bullshit, but I think there is some truth to the fact that easier access to AI is going to make it easier to develop these types of things. So the point is that the rate at which we are able to create new hypothetical therapies is only going to increase. Now, does that mean we still have to test them and validate them? And I don't know that AI helps there, but at least you can generate new like ideas and candidates and molecular structures, whether they're gene edits, mRNA, regular like psychedelic like small molecules. But lots of cool stuff coming down the pipe, I think.
Right. Do you? Oh man, where to go from here? Like the. So back to like drugs, I was thinking with what you were talking about before with the ability to potentially instantiate new receptor sites of specific kinds like that. You know, I could save a lot of money on LSD. I don't know. But, you know, not really. But, you know, it's an interesting idea. Like somebody could be like a non-responder. I don't know. I imagine there's going to be so many new treatments that like, yes, psychedelics will be part of the portfolio, but maybe smaller than we expected.
Totally. And and when you think about like every single drug, whether you're talking about a psychedelic or like Ozempic or whatever, there's always a big range in how people respond to them, right? Like some people
Mm-hmm.
respond really well. Some people have a great time on LSD. Some people have a horrible time. Some people lose a ton of weight on Ozempic. Some people seem to not respond. A lot of that has to do with just like what their natural receptor makeup is. And for now, it's like up until now, you've basically been stuck. Like if your body, for whatever reason, creates like more serotonin receptors or less than normal serotonin receptors, you're kind of stuck with that. And
Mm-hmm.
there's been no way to potentially fix that. But now, in theory, you may be able to.
Mm. Mm. That's interesting. Hmm. Are you so back to the AI thing? Like the
Mm-hmm.
I found some people right around the time of like PS23 and right after in Denver where people were using these really interesting AI mouse models that like,
Mm.
made the made the mouse life like I don't know, 20 times more useful or greater. So like each individual mouse like they were getting more data than a simple head twitch. And I found that interesting.
Yeah.
They were, they're doing like foot pressures and like all the movement patterns and all sorts of stuff there. So it wasn't just like an on off, like, oh, there's activity here. It's like, oh, we actually have some better data.
Yeah, I've seen a few companies do that where they basically have like a box and there are cameras on the floor and the sides and the ceiling and they can like watch the mouse and then they analyze the video using machine learning models. And yeah, they can get a pretty high fidelity interpretation of what's happening to the mouse. I mean, I still think that all that stuff is great, but ultimately you have to test in humans. Otherwise, you're not going to know, right? It's like we can't really communicate with the mouse and figure out what's going on. You can only guess by how it's moving or wagging its tail or whatever.
Mm. So, like, that was pretty much like the only really great thing I saw people publicly discussing around drug discovery. Do you
Yeah.
expect like there to be other ways to project like what might be psychoactive or helpful or even other kinds of drugs just
Well,
being helpful?
I don't know. Have you ever talked to Dylan from Mind State Design Labs? Or
I think I might have met him once. I'm not 100% on that though.
he's he's someone you should probably have on your podcast. So they're a company that we invested in, full disclosure. And they're a psychedelic drug company, but they have a very interesting approach to the act of designing psychedelic drugs. Basically what they did is first of all they took like every single trip report that they could scrape from the internet. So I think at this point they have like over 100,000 trip reports that have all been kind of like cleaned up, annotated, and standardized. And those are trip reports for everything from the common psychedelics like psilocybin to more esoteric research chemicals. And then they basically took all of these different psychedelic chemicals and they did like receptor binding assays, meaning that they were able to see like, okay, psilocybin binds to 5-HT2A this much, it binds to the other serotonin receptors this much, it binds to dopamine this much, it binds to this and that, another amount. And they basically then used AI, magic quotes, they used AI, natural language processing, to map those receptor activations to the specific themes or motifs that show up in the aggregate trip reports. So, for example, it turns out that every psychedelic experience is unique in some way, but there are consistencies that show up, and there are certain consistencies that show up like in specific drugs that don't show up in other specific drugs. So like the feeling of oneness, or as Dylan calls it, like oceanic boundlessness is one. Then you might have another thing like entities where like, you don't always see entities, but some people see entities. And they've
Mm-hmm.
basically created this map of like what receptors are required to be hit in which combination to create which specific feeling or trip experience. And they're using that as a guide to create psychedelic drug combinations. And what's very interesting is that the drugs that they're trying to actually run in the clinic are these combinations that are derived from this AI model that are based on Moxie, which you're probably familiar with to some extent, right? Moxie, a very pure 5-HT2A agonist that doesn't hit a lot of other receptors. So that's like their base, and then they combine it with already FDA approved non psychedelic drugs that are known to modulate the other receptors that are required to modulate the variety of the psychedelic experience. So, for example, to put this in like psychonaut terms, many people know that if you smoke a cigarette or hit a vape while you're on a psychedelic, that can change the experience, right? There are already plenty of FDA approved drugs that modulate the nicotine system. And there are other drugs that are already approved that combined with a psychedelic can modulate the experience in a specific way. So their vision is to ultimately, the 10, 20-year vision is like, we can basically figure out what mind state you're trying to achieve and tell you the perfect like drug combination to get there. And I think that's pretty cool.
Yeah, that sounds really interesting.
You should get Dylan on the podcast. He's like super. Yeah. He can go deep on this stuff. Yeah.
I just love that idea. I remember when was it? Maybe 6 years ago, somebody started sharing with me these kind of like far out, not over the counter combos, but like prescription med combos that people preferred over things like MDMA in major ways, and very precise dosing. And I found that really interesting at the time.
Yeah, it is super interesting. And if you just look online, there's like so much literature on this. I mean, I remember even seeing things as different as like some people literally like pop an SSRI with a psychedelic, which I've never tried and don't recommend, but there's that. And then I've heard some people say like, this psychedelic plus a tablespoon of cinnamon oil will give you like this weird experience. And I'm like, okay, weird, huh? Right. So I think that's one thing that, everyone talks about like, oh, mixing MDMA and psilocybin or whatever. Like that's what generally you hear, these kinds of like psychedelic drug combinations. But when you think about how many psychoactive drugs are out there that are already legal and already, available that you could potentially combine to modulate the experience, it's like literally infinite possibilities.
Mm-hmm. And I just to have people kind of understand this, like LSD is kind of known as what do they call it? Promiscuous or like dirty drug. It like hits a lot of receptor sites.
Yes.
And compared to, something like you were saying, Moxie, which is like really targeted, which is really fascinating.
Yeah.
And
and mind state,
there's a lot more work left to do.
There is totally. And mind state, we invested in them like right when they started up. And just earlier this year, they got approval from the FDA to start their clinical trials. And just, I think, a month ago, they started their first clinical trial. So they're actually doing phase 1 safety trials of Moxie right now to try and get that to the point where they can start trialing it with other things in combination. So this is not hypothetical. This is like happening.
That's super interesting. Yeah, and people should also understand, like, the reason we're working with these current drugs that are close to the finish line with the FDA, like MDMA, psilocybin, a few others, it's because they've been around for a long time, and we had some history. And now people are going to be able to develop these more patentable molecules. So I think larger groups are more interested in those kinds of things. So I could end up, I could see large cap biotech coming in and doing more acquisition activity around biotechs that are working on novel patentable molecules that they could bring through.
Totally.
Yeah.
And what's interesting about MindState though is that they're not even really inventing a new molecule, right? They're taking Moxie, which they didn't invent, and then they're combining it with drugs that already exist. So their IP is really just on the combination, not on the molecule itself. So a little bit different, but yeah.
And nobody else is really investigating Moxie, as far as I know. I've actually never heard of somebody doing it.
Yeah, as far as I know, they're the only ones. Moxie is also pretty interesting because it's not Schedule 1.
Mm-hmm.
It's I've
noted.
Research chemicals only not for human consumption. Do not take Moxie if you are a human.
Right. It's really good for doing tie dye with.
That's right.
Yeah, I've seen so much stuff like sold to like dye things. I'm like, sure,
I know.
That's gonna work. But yeah, I think it's an interesting one. I'm curious to see. Yeah, I can't wait to talk to him. That sounds.
Yeah. I will. I can certainly make that intro later. What do you think is the future of like the at-home ketamine stuff?
I liked how you threw in the Mind Bloom injectables earlier. I think people are paranoid about ketamine. Sometimes it's justified. Sometimes I think it's like people being a little overly cautious, right? Like we send people home with fentanyl patches all day long.
Right.
and we should. Like, I think that's a really good thing to do. People are in a lot of pain. Sometimes they're in so much pain that the fentanyl patches barely make a dent, and they're at like the legal limit.
Yeah.
So we need to be on these edges. I'm like, I think you know this about me a little bit. Like, I'm pretty much an end the drug war maximalist. So like I the idea that people should be incarcerated for this kind of behavior is insane to me. But
Sure.
then a group like Dylan's, like Mind Bloom,
Is yes, yeah. Mind Bloom,
because we're on the at-home ketamine injectors. Right. So like, he and his team were really careful in how they put together their data to see, is this a good idea or not, right? And there's a lot of people that have this caution of any bad result at all makes the whole thing absolutely invalid. And that's just not how medicine works. Like, there are going to be issues in a big population. We saw this with acid when it started going to millions and millions of people. We saw it with antibiotics. Like, once you get at scale, you start to notice these problems. So are they still worth having? Absolutely. But we need the data to get there. And Dylan and Mindbloom did that. They got all sorts of data. And, I haven't even talked to them yet. I think they're like nervous to come on psychedelics today. I've been working to make it happen.
Yeah. I interviewed one of their, not the CEO, like the director of clinical operations or something on my podcast a very long time ago. Mm-hmm. But I like it, man. I don't see like to me, the whole hand wringing about the injectables is just like needle phobia to me. Who cares if you inject it or you take it through a pill? It doesn't matter.
What other drugs are people injecting at home?
Insulin. Yeah.
Ozempic.
Like the most prescribed drug of all time. Yeah. Like, there's plenty of
the
drugs
soon to be most prescribed drug of all time.
Yeah.
Right. Like, it's interesting. Like, I think there's some needle phobia. I think some people just have this hang up on recreational drug use and how at-home use can look like it.
Sure.
And then they kind of freak out. And some people are maybe like overly paranoid about the addictive potential. I think there is addictive potential, but I think it's a little overblown.
For sure. It's much less addictive than fentanyl, which we still prescribe for all sorts of things.
Right. And, here's the debate. Like, I think you've probably watched this, is like, New Life, if we say something like old New Life versus Mind Bloom, like New Life was doing what, like 6 to 12 total lifetime ketamine treatments, and Mind Bloom is like, let's keep you in the pipeline for good.
Yeah, it's a good. I mean, it's an interesting point. I think that. Yeah, I mean, New Life. We were investors in New Life, so we got to see how that sort of turned out, and they certainly tried to make their whole thing from the get-go was like, we're going to do things the ethical way, and we're not going to put you on like the ketamine everyday train, which is probably good if you're trying to avoid you certainly keep in mind, this was at the same time as like that company Cerebral, which was like, prescribing Adderall left and right, that was getting shut down. And so I think part of it was like a genuine concern for like, we want to be in the healing business, not the like perpetual treatment business. And also just like, we don't want to look anything like these pill mills because we don't want like the scrutiny of the government. And unfortunately, they just weren't able to make it work. So, bummer.
Yeah, and I've chatted with that team a little bit about it, and like the competitive pressure from groups that are purely doing, here's your drugs.
Yeah, it's easy to say like, we're doing like the ethical correct model, and you're going to pay us, a few $100 a month for like 10 doses. And then there's like discount ketamine plus down the street that's like $99 a month, and you just get more and more pills every month. Like, at a certain point, people don't care if you're doing like the ethical path or not. They just want like the commodity product for the lowest price. And so very difficult to really stay afloat there.
So I think the ketamine scene will continue to evolve. I see a lot of pressure coming to kind of reform it, to make it a little bit more ethical, or perform clinically better. Like, I think, to me, that's the thing. It's like per gram of ketamine, how much clinical result are you getting long term? Mm-hmm. And I think that's the thing. Like, how do we get away from this, I need the drug to feel better, versus I'm going to leverage the drug to feel better and then use that window to get better.
Yeah.
Um,
And from what
and
I've
that's
heard
hard.
about Spravato, it seems to also be kind of a treadmill. People stay on it
Totally.
re- indefinitely, more or less.
And the people administering it don't understand this this kind of window of change that we can insert things to help them get back on track. And of course, that's not for everybody, but it's something that I think would work for greater than half of the Spravato users.
Yeah, one would hope so. I mean, the problem is it seems like any even all these like physical ketamine clinics that are run by people that are like psychedelic, people in the know that kind of like should know all this stuff that we're talking about. It seems like at the end of the day, it just ends up being the reality that like you have to figure out how to make money, otherwise the business is going to fail. And like a lot of times, the easiest way to make
Right.
money is to just give people drugs on a recurring basis,
Right. A
which
recurring
is a
customer base, totally. Like I'm gonna start actually reaching out to ketamine clinics to say, hey, like we can get you better clinical results, but you have to, to your point, get your business stable,
yeah.
and you have to have money, and then can you start to improve results once you're flowing and you have this kind of like flow of customers, and like
Yeah.
I think you can still retain customers for a couple of years, or sorry,
Probably,
patients.
yeah, and you can offer
Um,
other services. It doesn't have to be ketamine specifically. It
right.
just has to be one of many offerings.
Yeah.
People will pay a lot to
What
feel
are
good.
are you concerned about any kind of like crackdown from the feds on this ketamine thing?
No, as far as I'm aware, that's not something that is like being planned. I think that ketamine is going to continue to be prescribed somewhat freely. I mean, it's a drug that's very well understood by the medical community, and it's on the World Health Organization's list of essential medicines, and it's in every single ambulance that's on the street. So I don't think it's going anywhere.
Mm-hmm.
I'm more curious to just see what the future of psychedelics looks like. I think that if there's one thing that I think that RFK and like this new sort of like make America healthy sort of world could potentially do, it's accelerate the approval of ibogaine, or like maybe not approval, accelerate some sort of access pathway to ibogaine. It's funny to say, it sounds crazy to be like, I bet the first psychedelic to actually be made legal federally is ibogaine because it's like the most dangerous and extreme. But I have this like weird suspicion that because of the focus on veterans and because of the focus on treating PTSD and like
One
traumatic
second, I
brain
gotta show you
injury.
something. Hold on.
What do we got? Look at that. Oh my goodness. Is that a
Gigantic
moose?
moose.
Holy
Gigantic
crap.
moose was just a foot from my window.
Whoa. I wasn't sure
Yeah.
if you were going to show me an ibogaine tree or what, but no, it's
No,
a moose. Interesting.
it's legal here, but no. Or decrim.
Yeah, but it's like, and you see the fact that Rick Perry, someone who
Right.
still has quite a bit of political power, just went on Joe Rogan like 2 weeks ago to talk about ibogaine for 3 hours. I feel like there might be something cooking somewhere, and
I
it
Have
may
you
be
heard
the
what's happening in
case.
Texas at all? Because it seems like he's trying to do something at state level
Yeah,
there.
yeah, yeah. There's actually tonight, I think there's some big like meeting of the minds, some like psychedelic Texas meetup. I was just Googling what was going on in Texas earlier today. So yeah, I think he's pushing for like, if we're gonna have psychedelics, Texas might as well be the place that we have them.
It's like
Which
so
is also one of those
paradoxical and
things that's just so
interesting,
crazy. Yeah.
right? Like who would have thought? But with the stories, I think like the Navy SEAL community is kind of like trickling down and like
Mhm.
spreading their stories. Like that's a really powerful set of storytellers,
It is.
and kind of fetishize tier one operators, but like they're
Yeah.
about as impressive as they get, in a lot of ways.
Yeah, yeah. There are a group of people that even if people have negative opinions of, they generally keep them to themselves, right? It's like one of those things where you just kind of say, okay, this is good. And the other thing that's interesting about ibogaine that might like paradoxically help it get some sort of legal pathway is just that you can really make the argument that the access should be controlled and only be delivered in clinics, because even as far as I'm aware, like even the craziest psychonauts generally don't just like do ibogaine in their house, right? Like they try to do it at some kind of facility that has like a doctor on site and cardiac screening. And so yeah, like with the other psychedelics, there's going to be all this like, you know, panic about like, well, what if people just start doing it at their houses or recreationally? Whereas like you don't really get that with ibogaine.
No. Like I'm sure it'll happen, but like way
Sure.
lower scale, right? Like
Yeah.
who's doing salvia anymore, for instance, right? Like
Right.
very, very few people. And I'm afraid to microdose iboga, right? Like,
Yeah.
and I'm me, right? So
Mhm.
like, I think once the word gets out about how extreme the experience can be, and the safety factors, I think there's going to be, the ibogaine pill isn't some. We got an interesting comment here. Bring it up.
The
I don't,
ibogaine pill,
I don't
isn't
think
that
it's overly
insane?
crazy. Wonderful, if correctly measured. I would like to look into that. I'm curious about the difference between like whole root and molecule. I'm told it's pretty intense at the real dose level still.
Yeah.
Obviously.
I've only interacted with someone who claimed to be currently microdosing ibogaine once, and they were acting like they were on cocaine. Like the level of energy they were projecting was kind of nuts. I've never taken any form of ibogaine or iboga, whether in a full or small dose, so I don't know. But
Same. Same. I've touched it. But
that's the
you might
plan.
know this one. So Gould Dolin's lab at Hopkins and Dolan
Hmm.
lab, they studied this like length of neuroplastic window following drug
Yeah, the
administration,
critical period.
and Iboga just kept going. It just kept going, like, and they ran out of time, and the study ended. So it was at 4 weeks, I think, of neuroplastic
It's a
window,
big
and it could have
window.
been a lot longer. So if we keep stacking administration inside like a 4 week, yes, I think like I think if somebody's microdosing acid every day, they could have the same thing. It's just you get amplified over time, which is why I try to get people to take breaks as much as they can.
You get desensitized with microdosing. But if you're doing like a single macrodose of iboga, then you know, you're not getting desensitized. It's a one-off.
Yeah. Um, so, are you excited about any molecules or projects like outside of your portfolio?
Yeah, I mean, some of the stuff we were talking about earlier, like the gene editing for happiness stuff, I think is quite interesting. In terms of, I mean, I do think. I feel like everything always comes back to politics, but one of the things that's been like so funny lately in the last year is seeing like the resurgence of nicotine in like the right wing
Ooh.
community. You know, like Tucker Carlson's like advertising Zins, and you know all of the like Silicon Valley people who used to be microdosing acid, now they're all talking about the benefits of nicotine. I certainly don't think that people should be smoking cigarettes or popping Zins or vaping for that matter. Like all that is probably pretty bad for you in the long run, but there have been like countless studies on the neuroprotective benefits of nicotine and how that could nicotine or nicotine derivatives could potentially be used to treat all sorts of diseases of the brain.
Mm-hmm.
One of the things that you can see just anecdotally is how people that are schizophrenic, they chain smoke because it's like the one thing that calms them down. And have you ever like I used to live in like a apartment building next to this guy that was like actually like very schizophrenic, and he would smoke like 10 cigarettes a day. And it was like
Mm,
really crazy. That was the kind of the one thing that kept him stable.
that's
Well,
really
well known
interesting.
phenomenon. And so I do, and so getting back to the politics thing, like if you talk to people in the pharma world, one of the reasons that you ask them how come pharma hasn't like investigated nicotine or nicotine derivatives, their response is always like, well, cigarettes have such a bad stigma that like we can't do anything, even though we all know that it has some potential benefit. We can't do it just for like, you know, political, uh, social reasons. But now that it's like nicotine is cool again in a weird way, I wonder if that changes. And I wonder if we start seeing more like, you know, real pharmaceutical grade research on nicotine and derivatives thereof. So that's one thing I think is interesting. Um, I do always kind of like joke about this, but I would love to see some real scientific investigation into the coca plant. Maybe, you know, that can happen at some point. But no, I think that a lot of the stuff that we've been excited about for a long time, psychedelics, ibogaine, etc. I'm still excited about that, and that's more than enough things to be excited about.
Mm-hmm. I don't know if you saw this one, but Dennis McKenna hosted, I think it was Wade Davis and Mark Plotkin to talk about the coca plant the other day. And like the
Oh, really?
right, and Mind Cafe podcast or something, or Brain Cafe maybe. But yeah, I'm with you. Like these plants, they've been with us for a really long time. Why aren't we looking into them?
Yeah.
Um,
And then one of the other things that I'm certainly curious about, I don't know how much I believe in it, but there's this concept of transcranial focused, low intensity focused ultrasound stimulation, which is the same type of ultrasound waves that one would use to perform a medical ultrasound, you know, to like see a baby inside of a mother, to just like look at someone's knee if you tore your ACL or something. If you focus ultrasound beams in the right way, you can stimulate tissue even from outside the body. And there are communities of people that are using these sort of like DIY ultrasound stimulators to like hit their brain. And supposedly, it is a pleasurable thing, and the feeling of pleasure lasts a long time after you turn the stimulation off. So you do it for like 5 minutes, and then like 2 weeks later, you still feel good. There are some companies, I've not invested in any companies doing this. There's one called Sanmai that is, you can Google and you can look up. One of their co-founders is like this Buddhist monk who claims that the ultrasound basically feels the same as like what 30 years of meditating every day feels like. There's some sort of like biohacker communities in the Bay Area that are really into this whole like transcranial focused ultrasound thing. There's a lot of overlap between those communities and like the serious jhana meditator communities, which also has overlap with the psychedelics community. So that's something that I'm quite curious about, just like intellectually. I don't know that there's any sort of like business or investment there, and I haven't tried any of this stuff. I'm honestly a little bit paranoid, and I don't know that I would try it, but it's cool to see that there are groups out there that, in my view, are they're kind of doing like what the Shulgins were doing back in the day, right? It's like, let's just figure out this way to modulate our consciousness. Here's this like device that I made in my garage, and now I'm going to get my friends and we're going to go into like the park and we're going to like zap our brains at this thing and see what it's like. And it's like, that's kind of awesome, dude. That's like how progress happens.
yeah, I'm going to look into that. What was the company called? Sandmai?
Sanmai, Sanmai, Sanmai.
All right. Terrifying, but interesting.
And there's another one called Nudge Focused Ultrasound. I think nudge.com is actually their website. They're quite under the radar, but Sanmai, I think, has a little bit more info out there. If you just Google like Sanmai, Sanmai focused ultrasound, you'll find some videos on YouTube with the founders talking about it.
Cool. All right, Brom. Well, this has been awesome. People can check you out at what was your website again?
Yeah, the fund is focalpointlp.com, and you can just look me up on Twitter or LinkedIn, and happy to chat about anything related to psychedelics, neuro, the brain, gene editing, brain-computer interfaces, what have you. Thanks so much for having me, Joe.
Absolutely. And thanks for doing it. And thank you all for tuning in. If you want to support us, check out Vital Psychedelic Training at vitalpsychedelictraining.com. You can find it at psychedelicstoday.com if that's easier. All right. That's it. Signing off. See you next time, everybody.